All right. Okay. We will call the regular meeting of the Public Safety Committee to order on Wednesday, October 23rd, 2024, the time 6 p.m. And Jerry, have you noted the roll?
Yeah.
Great. And we'll move on to approval of minutes from July 24th, 2024.
Motion to approve.
Second.
Any discussion or changes?
I just had the meeting minutes.
Oh,
that
gotcha.
Needs to be removed off the top.
Off the top, noted. Thank you. And are there any appearances online? Anyone appearing? No appearances. There's no unfinished business. So we'll move on to 6, new business. A, discussion and action of new billing rates for 125 EMS fire. And that's going to be the chief telling us about that. And then just a note that it's not really anything that we need to necessarily do because it goes directly to the council. Right? Correct. It's in.
I'm just giving you all a heads up because our fees are split into two parts. One is the base rate, which is set by council or approved by council, and then miscellaneous supplies and mileage is set by this body or approved by this body annually as part of our annual fee update. So billing rates include the rate survey and the packets that got sent out. I had our billing company do a survey of other billing companies or other agencies and what they're billing. You'll see the column to the far right is what they advise us to set our rates at for next year to stay basically in line, not to be the highest, not to be the lowest. They want us to be right in the middle. So these rates will become effective January 1st upon approval of the council. And all those rates that you see there, the first 5 are what I'm talking about, which is our BLS transport, which is our basic level, ALS, which is our advanced level, ALS 2, which is our really bad calls, cardiac arrest, that sort of thing. And the next 2 are our treat no transports. We show up and do something, but they don't want to go to the hospital. That's the charge along with any supplies that we do detailed billing. So again, this is strictly for your information, just so you're aware of what's going on in the council. That was beaten into my head by Alder Thomas while she sat on this board or on this committee that she wanted to know about this stuff before it came to the council. So wanted to make sure you're all aware that that's what will go to council probably the first week of December for approval by the second meeting in December if we have one. If not, we'll do it for a single read on that first meeting in December. And then it goes into effect on January 1st for any calls that come after that point. So I'm happy to answer any questions about our billing rates or how they're set or how they affect our collections, but it's more information for this body than anything.
Can you update every year?
We do a survey every year. These last few years we have updated every year just because where we started to where the average was too high for us to get to in a single year. It would have doubled our rates. So we went up X amount the first year, X amount the next year. This brings us up to the average for the county. So hopefully this will be the last increase for at least a 2-year period. I don't see us going much higher than what they're proposing. You'll notice some of the agencies on this list are way high. We're not looking to do that. We need these billing rates are set for insurance companies. So it's what the insurance companies will pay. 67% as of so far this year are Medicare or Medicaid patients or those on managed care plans. So they already have a predetermined amount. They cut that rate down to what they'll pay. So it doesn't matter what we set our rates to. We're going to get $421 from Medicare for a BLS transport. That's what they pay. I can bill them as much as I want. They just write the rest of it off. Same thing with miles. We bill X amount. They cut it down to whatever they're willing to pay at the federal level, and that's what we get. Everything, and we cannot balance bill patients. So once Medicare cuts it, that money just gets written off. So these rates are built for what insurance companies pay, and then Medicare, Medicaid cuts those down to what the federal government's willing to pay, which is not a lot. So Medicare right now is $421. Medicaid is 80% of that, so about $340 is what we get for a Medicaid payment based on our base rates.
That's gotta hurt.
That's the difficulty in budgeting. So I said, just so you're aware, that's how I budget for revenues every year. Is I look at our payer mix from the last year and then apply the new rates, the new mileage rates based on those percentages, knowing that, yep, I can bill out this 19% insurance company payer mix to this rate. But I know that this 65% I need to bring down to this, and that's how much I can collect off of it, so. And then there's always 8 or 10% that are private pay with no insurance, no Medicare, no Medicaid, no nothing.
Nothing. What percentage was that, anything?
8 to 10%. It usually it runs between 8 and 12%. This year we're lucky. Our payer mix on insurance is about 21%, where we've traditionally ran about 17. So we're collecting more from the insurance companies. So, but it all fluctuates within 4 or 5 percentage points. We have a higher elderly population, so we have a higher Medicare number than a lot of communities that.
So maybe these other communities set their rates higher, knowing that they're not gonna get it.
It makes
90% of the
themselves
time.
look better on paper that, hey, we billed out $2 million this year. Yeah, but you still collected the same $400,000. So
Yeah,
we don't do that. What we put in our revenue estimate is what we expect to collect, not how much we bill out. So, right, I can tell you this year we've billed out 1.3 million. We've collected 430. So we try and run around a 35 to 40% collection rate when we bill out. So, but I don't put that gross charge into my budget and say, look, we're billing out $1.2 million, because then I have to put in a $800,000 bad debt write-off on the expense side to be able to make it equal. So we just don't do that. We just budget what we expect to make.
truth in budgeting.
Yeah.
We do our best. It's like a dartboard, so we do our best. So, but again, any other questions, I'm happy to answer on the billing rate side.
Any other questions? All right, seeing no more questions, thank you, Chief. We'll move on to the next item. Discuss action on disposable and mileage charges for 2025. Chief.
Yeah, and this one is one that I would need approval from this committee. You set these rates. The supply rates have not changed. You see where on the far column it says 8/1/24 updated. That's because myself and our billing liaison, Lisa, go through this list every year, make sure the codes are correct, and make sure that if prices have increased, we update the price to account for that. So it's the overall price of the supplies has not changed. There are 1 or 2 that have like a CPAP mask, maybe went from $60 to $70, but we generally charge 3 times the cost of that item as the supply charge. Except on the low cost items, your syringes, stuff like that, there's a base charge of like $2.
Why is that for $5 per tablet?
That's the base rate for medication.
Yeah.
That's the low end. So
Okay.
basically, when we give aspirin, we give 4, so the charge is $20 for the 4 aspirin. Any disposable, non-invasive supplies, I say your alcohol process, all that stuff is like $2 for the item. Mainly because it becomes very difficult to separate out price wise. I get a bundle of 50 blood glucose strips, and it costs me X dollars to go down and say, well, this particular thing cost me 0.0035 cents per strip. We just set the base rate at $2 for any of the small disposable things that we go through. The biggest amount that we collect is actually on gloves and surgical masks, because we use them on every single call.
Gotcha.
So we charge $6 for pairs of gloves and $3 for a surgical mask for every one of our people that's on a call. So that those supplies are on every single call. So again, I would put a 99% number on this, that the prices simply haven't changed. Because a lot of them are set at a base rate and they just don't fluctuate. But the 8/1/24 updated just shows that we've looked at that. The codes remain the same for billing on the billing side. Anything that changed would be highlighted. And if you notice, everything is green. So there are no price changes on this list. The other half of it is mileage. Mileage is on the first document that you had our rate survey. It's that last row on that last column, and our mileage rate is going to go from 22 to 27 per loaded mile. So whenever we start transport and whenever we get to the hospital, that's what the patient gets charged per loaded mile. Ours has been low for a couple of years, mainly because of the
Seems low.
yeah, and it's been low countywide. So when they went through and updated all these, they're like, no, you need to bring your mileage rate up. That's the number one thing we can do to actually add revenue, because we have short transport distances, so being able to add those miles on there really adds revenue that we can collect, particularly from the insurance companies. So we average 5.8 miles per loaded transport. So the average EMS bill will go up $12
Okay.
with that mileage change charge. But that's one that occurs on every single transport. Happy to answer questions.
Does Medicare or Medicaid cover these full costs, or do you have to budget?
Maybe.
Okay.
Medicare will not pay for disposable supplies at all. Medicaid will pay for certain supplies, depending on who's approving it. The state will pay for some certain supplies, but they won't provide us with a list of what they pay. And the federal Medicaid program will pay for certain supplies, and it doesn't match up with the state Medicaid program. So as of this year, we're actually getting an idea of what they will actually pay for, because the billing company that we use transition us to something we can actually see the EOBs and what they're actually paying, and the percentages that they're reducing us down by on every individual patient, so we can actually see what they pay. We also charge for procedures, so if we do a 12 lead, there's a charge for that. If we do oxygen administration, there's a base charge for that. Medicare and Medicaid won't pay for those, but the insurance companies will, which is why we bill those out. It just becomes part of the lump sum written down if it's a Medicare or Medicaid patient. And to address folks that are a little bit more financially insecure, especially the folks that don't have insurance, we have a very aggressive write-down policy that they can, if they can't pay, all they have to do is contact the billing company and say, hey, here's the income that I've got, and they're authorized by me to write down a significant amount of that, to bring it down to more what a Medicaid or Medicare patient would pay. It's a pretty easy process. It's a single page you have to fill out.
Do they like verify income or?
Yes.
Okay.
So there is some extra work they have to do on their end, but we also offer, the billing company calls me and says, hey, we've got somebody that's submitting a hardship waiver. I get in contact with them. If they don't have the resource, come in. I'll help you walk through it. I'll help you do it. It's not difficult, but if you don't have the resources to do it, bring in what you have for bank statement, bring your stuff in, and we'll help you walk through it. And then I help them get the process started, and then I approve it on the back end once it hits the billing company. And they set up payment plans of $10 a month, whatever the person can afford. As long as they're actively working to try and pay it back, we're very flexible on if it takes 3 years, it takes 3 years. That's in that payer mix of no insurance, no Medicare, no Medicaid. We're very flexible on our payment plans. And writing down the cost, so they're not paying $2,700 for an ambulance bill. We can write that down and match Medicaid or Medicare for them, as long as they can provide the income verification that we need.
That's great.
Question about the naloxone or Narcan. We talked about this once, but I forget if officers are carrying that.
Officers are carrying that.
And what if they use it as opposed to you?
If they use it, we bill for it.
Oh, you still
Because they
don't-
get the Narcan from us, so it's our stock that they have in their vehicles. So if they use a bag valve, if they use gloves, if they use Narcan, we add that into the call itself and bill it out as supplies, because we provide all the replacement supplies for them.
That's good. Have you seen that increase, decrease is about the same as far as usage? Is that still?
Overdose wise, it's been high in Dane County this year. Sarah, you can probably speak to this better than me, but how many times has Dane County Health put out the overdose? So 4?
Quite often. Yeah, I can't say exactly for sure without looking up calls, but they're pretty frequent. And then we also, I mean, they're kind of clustered. So although we get them on a regular daily basis, we do see sometimes an influx of drugs that are tainted with fentanyl, for instance, and then we'll get a higher number when those drugs are circulating.
And those alerts come out because Dane County monitors the whole county. So if all of a sudden Madison on the east side is getting a hot spot on the heat map for overdoses, they'll send out an alert to the whole county that says, hey, we're having a spike in overdoses. basically keep an eye out. So Dane County's been really good about monitoring that and letting the rest of the county know. If we have a spike, they let the whole county know that, hey, Monona's having a spike in cases, just be aware there might be some tainted materials out on the street again. And it happens way too often.
Was it grant money? I know that a long time ago, back in the day, is that kind of gone away and now each?
They went in a different direction with the grant money. So we have an oak box downstairs, which is an overdose kit that people can come up to freely and get Narcan. So if you have family members that you know are addicts, you can come get Narcan to take home and use for no charge. The county provides the restock for that out of their grant funding. We're in the process of adding Hope kits to our trucks as well, which is leave behind kits. So if we go to an overdose, we leave a kit with the family that says, hey, here's some more Narcan, here's some gloves, here's some help resources to leave with the family. And then Dane County provides those for us as we hand them out. They've been used pretty successfully, actually. And we're working on a pilot program to start buprenorphine instead of Narcan for overdoses. There's a lot of evidence out there now that buprenorphine actually still cancels the effects of the opiate, but doesn't hit them with withdrawal symptoms. That's our biggest struggle. Is if I give somebody Narcan, it shuts everything off opiate wise, and they go from high to withdrawals in the space of the time it takes them to wake up. And it makes them very difficult to get them to the hospital because all they're focused on is getting opiates. They're in withdrawals. Where it removes the respiratory effects of the opiates, but leaves them enough of the high that they're much more willing to listen to reason to go to the hospital and get help. Out east in, I believe it was North Carolina, they saw like a 93% increase in people getting help by switching to this medication.
What was that medication called?
Buprenorphine.
Okay.
I'll actually have it at the next council meeting. The pilot program that we're looking to be part of here in Dane County to start utilizing that in the field, because again, they're in a much better mindset for getting help because they're not just focused on going and getting that high back and getting out of the withdrawal symptoms. They're like, oh, I just about died here. I better go get some help here. And they're much more reasonable about going to the hospital and getting help. So we're hopeful that'll be a benefit as well, because there's a lot of it in Dane County.
Gotcha.
How often do you, or Monona's or Monona EMS deal with that kind of issue?
We just had an overdose last night. This month, I think we've had seven overdose calls. Not necessarily all opiate related, but 7 overdose calls.
Okay. And that's kind of the going average?
It fluctuates. I mean, some months we'll have 15 or 16 overdose calls. Some months we may have none. But average, 6 to 7 a month is a pretty solid average for overdose calls.
Wow.
Any other questions? Is there any reason why we wouldn't increase the mileage charge?
I was just going off their recommendations. I'm happy to set it at whatever rate you would feel appropriate. My initial thought when they first said your mileage was low was setting it at 30. And then they came back with the rate survey and it came in at 27. I would be happy to take it up to 30.
Are we governed by any kind of law that says it can't really be much above what it actually costs us?
No.
No. Like all the other fees that we send.
There are a lot of rules and regulations. No. 30 is within the range of what they would provide to us anyway. 27 is what the average is for our surrounding communities. Again, you notice one of the communities that has their set at 35. And they're out in the middle of nowhere, so their transports are 20 and 30 miles. So they're adding $1,000 a mileage onto their bill every call.
Yeah, but I think, part of the justification for making ours a little higher is the fact that our trips are so short.
Yeah.
And it's not impacting the individual that much.
Yeah.
But it's certainly adding to.
It does help.
Would anyone be willing to increase that?
I would be in favor of increasing it to 30.
Yeah.
Do you want to make a motion to do that? Or we need to make a motion to approve.
A motion to approve the supplies and mileage, and you can, in your motion, you can.
And in your motion, you can
Tell me what you want the mileage rate to have to.
Yes.
Okay, so a motion to approve it at 30?
And if you can include the disposable
And
supplies.
a
as well.
motion to approve the disposable
Yeah,
cost?
so motion to approve the disposable and increase the mileage to 30.
That works.
I'll
Does that
second
sound,
Yes.
okay. Any further discussion?
The mileage. So that goes out to everyone, and if they're on Medicaid or Medicare,
Yeah, Medicare will not pay mileage, Medicaid pays a percentage of it, so if we bill out, just as a fictionary, if I bill out $30 or $50 in mileage, they'll pay $9. Their percentages are not very well or easy to find, and again, the state Medicaid program pays a different percentage than the federal Medicaid program, so they pay a percentage of what we bill out for mileage. Medicare does not. Medicare doesn't pay for mileage.
and what about insurance
Insurance pays it in full.
in full, no matter what it is, or
Yep.
is there a limit?
Nope. They always want us to bargain with them they want us to meet with them and sign a contract to pay X instead of the full rate, and we decline that every time. They can pay the full amount.
Right.
I worry about those hardship.
Yeah, that's.
So if somebody's having, submits a hardship waiver, it's the bulk of the bill. It's the entirety.
Okay.
It's not split out separately as, hey, we'll write this down, but you still have to pay it. It's the bulk amount.
Okay,
We write the entire thing down if somebody's having a hardship.
And we're talking about like, at 27 cents, like the average add to the bill was like $12, right?
At $27 per mile is like a $12 increase. So
$12
30 will make it like 15.
15. That sounds reasonable. All right, all those in favor?
it.
I-
Motion passes.
You're welcome.
Thank you.
Thank you. All right, moving on. Reports.
Been busy. Saturday, we had 13 calls in a 24-hour period. So really leaned on our volunteers on Saturday because, again, we had multiple calls going on at the same time all day long. Had a significant call that most folks are aware of with the car in the canal early Monday morning.
Are you able to share any more info about that or no? I don't know if any more has been released.
That I can't share other than say, please refer to the police department for further questions on this investigation.
Gotcha. I know there's some people that are like, what happened? And then there's like some chatter about, was it a pursuit? And I know it's not a pursuit.
It was not, I can definitively say it was not a pursuit. What I can say, just based on, the discussions at the fire department level, the individual driving the vehicle, was last seen on camera roughly about 40 minutes before the accident occurred.
Gotcha.
So our estimate is that vehicle's in the water about 40 minutes before it was noted by one of our police officers driving by who called. Took us an additional 50 minutes to be able to get to the individual because the vehicle went nose down into the channel and then tipped over on its roof.
Gotcha.
So the heaviest part of it was down in that 4 foot
It's
of
crazy
water.
that no one in the apartments heard that occur,
He missed everything.
Yeah.
The only thing he didn't miss was the channel, unfortunately. So there were no other impacts that we noted when we got there. Really good call from the fire department standpoint. We had Madison Dive team come in without their boat. They just brought their vehicle and went in the water with us. We had 2 of our water technicians in the water within 7 or 8 minutes of the call coming out. They were just simply unable to get in the vehicle. So we had to get more resources out there. Having Madison Fire there was great. They worked right alongside us. We had 4 folks in the water, 2 from us, 2 from them. Ended up having to use our battery operated spreaders to actually get the door open against the mud because it was just, we couldn't even break the windows. There was too much mud and so it was an extended time to get the individual out. And but overall the cooperation was very well received. Everybody did a great job. Getting in the water, getting out of the water, no injuries.
Good. Tragic.
Yeah, Yeah, other than that, it's busy. I think, when I looked at the calls this morning for the month, we're at 115 for the month already again, so. It's very steady getting 4 or 5 calls a day. We've had 4 today already. So I expect we'll have at least 1 or 2 more before midnight. But that's all I got.
Right.
Try to keep it brief.
Thank you, Chief. And is Brian still on, or is Sarah, are you?
No, I'm
Okay.
here for the report tonight, so,
All right.
police department side, as far as staffing goes, we currently have 1 vacancy. And we are recruiting for that vacancy. That's. Once we get the application process, completed and approval, we'll bring that person on board, but, again, currently just recruiting for that open position. We had our canine golf outing a couple weeks ago, I think it was 2 weeks ago now, on, gosh, I can't even think of the date, was it the
October 12th.
12th? Thank you. I'm looking at the date here going, how long ago was that? So that was a good time had by all. We had lots of, golfers, participate, and then for those that didn't necessarily like golfing, we had some bags tournaments as well. So we're kind of trying to expand to bring in more people, and they just had it was unbelievable, the donations that people provided for that. They we'd like to thank everybody for the donations that they provided, and if you were there, thank you for your support. If not, please think about coming out next year when we have this. There's lots of great raffle prizes that are donated by many of the members of the community. We have been busy with, obviously, as the fire chief said, we had a call this last Monday, early morning hours, where the officer came upon the vehicle in the lagoon, our channel. And in addition to that, we've had 2 of the dignitary duties the last week. So we have been providing anywhere from 4 to 6 officers for each of those visits, and that kind of ties our officers up for many hours at a time. Delays with, if the speeches go longer or the planes aren't quite on time. So we keep busy with that as well.
Traffic all the time.
I'm sorry, I
It's-
didn't get it.
Those 2 events have certainly made traffic very fun to deal with.
Yes, shutting down the Beltline is never a good idea, but obviously it's necessary in these cases, but
Yep.
it does create a lot of traffic issues. So. That's pretty much all I have from police department side.
Thank you very much. Any questions of Chief or Chief?
For the dignitary protection, is there any reimbursement for that? Is that overtime? Does the city just have to eat that? How does that work?
Generally, we have been using officers on duty, or sometimes we'll have like our sergeants who are willing to flex to a different shift. So it hasn't, I don't believe, created overtime for us. But there isn't any reimbursement that I'm aware of. So.
Sarah?
Yes.
There was something going on the Beltline, I think Monday, there were like 2 police cars blocking off the on-ramp over by Southtown, and another 2 cars. I'm just curious. I haven't heard anything about that. Do you know about that incident?
Do you know about what time?
Midday, I would say.
Are you sure it wasn't yesterday for the
Could have
dignitary?
been.
Yeah, that would have been a
That-
dignitary thing.
that was one of the-
Oh, that was
Yeah.
a dignitary thing.
Yeah.
Oh, okay.
Yep. So
Yeah,
they were
I think I
preparing to
caught
shut the road down.
It was great.
Oh, that's why they.
I totally forgot what was happening. I may have broken the law, but I'm motorcycle.
We're being recorded.
Have you noticed that?
Right. You wouldn't be here right now.
Anyway. Any other questions of either chief?
My only other question is the opening that you have, what caused it to be vacant? Do we know details of why the former employee left?
I'm not at liberty to share information
Okay.
about why the officer left, but he did resign his position.
Is there any part-time stuff going on? Is it? At one point, we talked about maybe having some part-time officers. Is that a possibility or is that not in place yet?
So we did have a part-time officer who was one of our previous full-time officers. He has since taken on a canine assignment at his full-time job and has welcomed a second child into the family, and so this part-time just wasn't working out for him anymore. So he resigned, but we do have a process as well for part-time officers. We just do not currently have any hired.
You want to come out of retirement?
Absolutely.
Come on.
No.
Great. Any other questions? All right, then with that, can I get a motion to adjourn?
Are we gonna talk about the?
Oh, I'm sorry. Oh, I'm sorry, Police and Fire Commission. Sorry about that.
No update. I would have spoke up if I had any updates. So no updates until that recruitment gets farther down the road.
Gotcha. All right, next meeting is scheduled for November 27th, 2024. There's an attendance poll of members, so, everyone make sure you can, or let us know if you can attend or not. Otherwise, that meeting might need to be rescheduled. So, and a lot of
Do we
people.
email Brian or?
Yeah, email Brian.
Okay.
Because it's obviously a lot of people are out of town. So, so with that, motion to adjourn,
Make the motion.
Second.
and almost in favor.
Aye.
All right, thank you very much, everyone. Thank you.
Feel better, Jim. Gotta be a record.
Bye. Thank you.
I was thinking that.